My name is Rebecca Polston. I am the owner of the Roots Community Birth Center and a midwife. The Roots Community Birth Center started out of my original practice of Roots midwifery. I've been a home birth midwife for about 5 years now, practicing in home birth and attending women throughout pregnancy, birth, and postpartum. But I found that though we gave amazing care, a lot of people couldn't access that care because it's expensive. It's cash, insurance doesn't cover it. And I really wanted to create a space where women could come and get that care while being able to use their medical assistance or use their insurance coverage. 58% of all births in the Twin Cities are births by women of color. African American, Latina, First Nations, our African sisters. So 58%, that's the vast majority. I also know that women of color typically have much worse outcomes, particularly for First Nations women and African American women. And when I looked at the other birth centers, I saw that they were doing 1% of their population were people of color. So from a pure business standpoint, if most of the births are by women of color, you should be serving women of color. That's who's having the babies. But also I wanted to really fundamentally address this big issue of lack of prenatal care, lack of cultural competency, and preventing preterm birth and low birth weight. We're almost a year old and we've grown incredibly quickly, although there have been a lot of growing pains too. I'd predicted that we would do 2 to 3 births a month for the first year. And by our 5th month, we were booking 6 to 10 clients a month. So we grew incredibly fast. I was hitting my 2nd year booking goals already. And so I had to hire an office manager and additional staff because I couldn't do it all. WomenVenture really came through for us to both have working capital to handle the expansion, to cover staff costs and the increased insurance costs and the increased material costs of expansion and rapid growth, but also being able to provide that technical support around running of the business. So they've provided a bookkeeper who has been instrumental in helping me manage the growth because it was way more complicated than I expected it to be, but also connected me with a really good accountant who understood medical accounting so that my taxes were well taken care of. So that's been an amazing resource. But I'm also receiving technical support on marketing and putting together trade show displays and legal help. So we've been able to handle the growth and do it professionally. So now we have a staff of 6. We've been able to secure several insurance contracts. So we have Blue Cross Blue Shield, Health Partners, Medica, and UCare and Select Care. We're able to really serve a large portion of the community here in North Minneapolis and actually around the metro. We, as women of color, can and deserve to have healthy full-term babies and positive birthing experiences. And so I centered that around every aspect of this practice. So far we've had 100% term pregnancy. There have been no preterm births in our practice. It's working.